We have just concluded the formal presentation on our video on evolution and treatment and outlooks for research and in bladder cancer. We'd like to just take a moment or two now to touch on some highlights and have a more informal discussion. So I'd like first to address Dr. Kassouf and ask him, in your presentation you shared with us a very dramatic and troubling statistic or trend line that a great number of patients are not receiving any effective treatment for their bladder cancer. And can you share with us any ideas on how this huge shortfall, this huge gap in the treatment of bladder cancer can be addressed?
Yeah, so just to clarify, Ken, so the main point is patients with life-threatening disease. So patients with muscle-invasive bladder cancer, the standard has been for the last couple of decades removing the bladder. And what's been noticed in North America, the States, as well as Canada, that many patients with this life-threatening disease are diagnosed and they're too sick to undergo surgery and not offered any other therapy to try to cure this cancer. We do know that trimodal therapy, the combination of radiation and chemotherapy, works very well in patients that are appropriately selected for that therapy. And my point of view is often what's happening is patients who are too sick to undergo surgery, they're not offered this kind of alternative therapy which has comparable outcome when you're choosing your population wisely. So I think every patient who's too sick to undergo cystectomy or prefers not to undergo cystectomy should be offered this appropriate treatment option.
Dr. Zlota, in your presentation you outlined for us some really exciting developments and evolutions in the area of personalized medicine. You also indicated that there are some cost considerations which are quite daunting. And can you indicate to us your personal expectation about how these two competing issues can be rationalized and reconciled?
Yeah, I think it's a great question. South of the border, many patients now with cancer have their cancer genetically analyzed. Doesn't necessarily translate into treatment, but this is a very, very common trend. Now, if you think of the amount of people who get unnecessary treatment, quote unquote, and especially at a time when many of these treatments are very, very costly, you could think that spending a couple of K on a predictor which is accurate so that only those people likely to benefit will get it may actually end up somehow paradoxically into saving money for our health system rather than spending money. So I'm not pessimistic. I think that there's a way to overcome these high costs, but it needs more research and more focused research.
Dr. Black, you outlined for us the ways in which immunotherapy will be applied to both localized and advanced bladder cancer situations. Can you describe how that would be sort of rolled out or integrated with or complementary to the personalized medicine approach which Dr. Zlota talked about?
Yeah, well, I think those two developments are really happening in parallel. So as new checkpoint inhibitors are developed and tested clinically, there's a lot of work being done on biomarkers to predict which patients will respond. I talked a little bit about the expression of PD-L1 in tissue, so that's the target of the drugs, and we know if the target is there, the drugs work better. But even the patients who don't have PD-L1 respond well enough that we're not willing to withhold the drug from them. But there are other markers that are being looked at. I talked a little bit about how many mutations there are in bladder cancer, so any individual patient with a very high mutation rate responds better than those with a low mutation rate. And there are various other tests that are being evaluated. I think we'll really be able to say patient A should get this checkpoint inhibitor, patient B should get a different checkpoint inhibitor, maybe the combination. So I think immunotherapy and personalized medicine are evolving together.
That concludes our presentation on the state of research in bladder cancer. I hope you found this presentation to be illuminating, helpful, and encouraging to you in your journey through bladder cancer. The fact that Drs. Black, Kassouf, and Zlota have devoted so much time to the preparation and presentation of this video is illustrative of their commitment to you in their capacity as both researchers and clinicians to seeing to the improvement of your welfare and your health through innovative bladder cancer treatments that are coming along in the future. We at Bladder Cancer Canada will be committed to sharing with you information on new developments as they come to our attention on a timely basis. In the meantime, if you have any questions or comments about this presentation, please contact us at www.bladdercancercanada.org. We'd be very pleased to hear from you, and thank you very much for watching this video.